Daraprim, or pyrimethamine, is an antiparasitic drug used not only to treat toxoplasmosis but also pneumocystis pneumonia in AIDS and cancer patients. In August of 2015, Martin Shkreli, CEO of Turing Pharmaceuticals, announced the company's acquisition of the drug. The next day, Turing Pharmaceuticals announced a price hike of over 5,000%, $13.50 per pill up to $750 per pill in one night. Despite backlash on social media from thousands, Shkreli stood by his decision, calling respected reporters idiots, claiming it was justified and that, quote, this field definitely needs new ways to treat toxoplasmosis. Shkreli is not new to these practices. He'd been kicked out of the previous pharma company he'd founded, Retrofin, due to his liability. When a reporter asked if Shkreli would have done anything differently in the last few months, Shkreli only noted that he would have increased the drug price to an even higher number.
If you could rewind the clock a few months, I wonder if you would do anything differently.
I probably would have raised the price higher, is probably what I would have done.
Toxoplasmosis isn't actually a serious enough disease to warrant a $750 per pill price tag. The CDC reports that up to 19% of the U.S. population may be infected with toxoplasmosis and they don't even know it. Doctors that have been prescribing Daraprim note that there is no dire need for an alternative to the drug because there is, quote, no significant drug resistance problem with toxoplasmosis. So then what was Shkreli's real motive for the price hike of a drug that treats an uncommon disease that many people live with without treating?
And if there's a company that was selling an Aston Martin at the price of a bicycle, and we buy that company, and we ask to charge Toyota prices, I don't think that should be a crime. We're simply charging the right price that the market's missed, the prior owners have missed, and we're doing something very good with those profits. We're putting them right back in the patient's hands.
Despite Shkreli's claims, Turing Pharmaceuticals has invested no significant amount of money into researching alternatives for Daraprim. But Turing Pharmaceuticals isn't the only company to use such price hikes on uncommon drugs. Pharmaceuticals company Valeant purchased the drugs Isuprel and Nitropress and increased the prices by 525% and 212% respectively. CEO of Valeant Pharmaceuticals Michael Pearson released a statement recognizing that the price gouging was too aggressive and promised changes which were seen soon after. In September of 2015, Shkreli announced that the company would be reducing the price by an unstated amount. Later that week, the company announced the discount would only be to hospitals that bulk buy the HIV medicine, and it would only be a 50% discount of the current $750 per pill price tag. 50% of $750 is still well above the price of Daraprim before Turing's price gouge. For the average HIV patient, a month's worth of pills would cost around $27,000 uninsured. Decisions like Shkreli's and Pearson's to gouge prices of crucial drugs have attracted a lot of attention from the campaign trail this year. Hillary Clinton, Donald Trump, and Bernie Sanders have all spoken out against the drug hikes at their events.
And it is time to deal with skyrocketing out-of-pocket costs and runaway prescription drug prices that are going up last year by 12%. I mean, it's disgraceful. Go online, read this article in the New York Times today about a pill that is really important, and the company decided rather than continue to charge a small amount, they would up it to $750 a pill for no good reason. Medications for a lot of diseases are going up to thousands of dollars a month. And when you look at that article that I referenced, to go in one day from $13.50 to $750 because the company said it needed more profits. I am announcing a detailed plan to crack down on these abuses. There's no excuse. Look, we want companies to get a fair return. That's the way our system works. There's no excuse from going from $13.50 to $750 for one pill. We're going to start by capping how much you have to pay out of pocket for prescription drugs each month. And we're going to start holding the drug companies accountable to drive down the prices. Nobody in America should have to choose between buying the medicine they need and paying their rent.
As Dr. Marsha Angel, a senior lecturer in social medicine at Harvard Medical School and a former editor of the New England Journal of Medicine, recently wrote in the Washington Post, and I quote, "Why do drug companies charge so much? Because they can," end of quote. Simple truth. There's not a rational economic reason for that. They charge outrageously high prices because nobody is stopping them in this country. Mr. President, the United States is the only major country on earth, the only one, that does not in one form or another regulate prescription drug prices. And what that means is you could walk into the drugstore and the pharmacist tomorrow and you can find that the price that you are paying for a drug that you've been using for many years has doubled, tripled, or gone up 10 times. And the United States Congress has chosen to be the only major country on earth that does not address this issue.
I don't take the donations, and so I'm self-funding, essentially, self-funding my campaign. Meaning, when it comes time to negotiate the cost of drugs, we're going to negotiate like crazy, folks. So you're talking right there, one item, government waste, one item, 300 and maybe more than that, $300 billion. I mean, can you imagine that?
On December 17, 2015, Martin Shkreli was arrested for securities fraud related to his last company. He posted the $5 million bail soon after.
He was arrested today on suspicion of securities fraud, and it's not related to what he's really been criticized for over the last several weeks, which is hiking up the price of life-saving drugs through his company, Turing Pharmaceutical. But it's actually transactions and payments that he made using money from a previous firm that he founded called Retrophin. So he basically is accused of taking money and stock from Retrophin and using it to pay off personal and unrelated personal and business debts.
Shkreli has since stepped down from his position as CEO of Turing Pharmaceuticals. CEO of GlaxoSmithKline, Sir Andrew Whitty, has high hopes for the future of the American pharmaceutical market.
Why do you think America spends so much more on health care?
Well, part of it I think is good news. So I think people in America, the American society system, is the most demanding in the world. They want the top quality, they want the most innovation, and they are pretty insistent on getting it. They are not keen on being told they can't have that. So first of all, it's driven by people's desire for the best. There's no question. But secondly, I think, let's be honest, the US, uniquely in the world, has an absolutely comprehensive government administration system across the whole of the US and an absolutely comprehensive private administration system across the whole of the US. Most other countries are one or the other. They're either typically private or they're typically public. But here we have an enormously duplicative set of systems. It's a very complex regulatory environment and there are significant friction costs associated with that.